18th. We're going to also be discussing some of the key themes that came out of that webinar based on the Q&A feature. So we'll talk a little bit about using the IPCANs across system partners. We will take a deeper dive with the County Practice and Improvement Plan, the CPIP. We're going to do an overview of that, dig a little deeper into it. Also give you some demonstration and share the screen there about how to complete the CPIP. We're going to look at the CPIP completion guide. We're going to look at some of the data sources that are going to help inform the CPIP. And then also discuss a little bit more about the technical assistance that is available to counties for this process. And then we'll wrap up with some closing. We'll get your feedback on how today went and talk about some upcoming opportunities with the ongoing learning collaborative, the ongoing webinar series that we have, as well as the Learning Lab. So again, we're super happy to have all of you here today. I'm going to ask if our team could do some very quick introductions. Emma, April, Shelley, and our CDSS folks, if you wanted to just do some quick introductions, and then we'll dive in.
Hi, all. My name is Robin Emme. I'm with the CFT and CAN support unit at CDSS, or the California Department of Social Services. And I'm here with my colleague, Dana Andrasky, as well. So you'll see our name just has our unit in there. We'll have a few others joining us as well while their meeting wraps up. So excited to be here and talk CPIP and Fidelity with y'all.
Thanks, Robin. And I'll go ahead and kick it to Emma. I'm just kind of looking at my screen. We'll go in order on what's on my screen.
Good morning and almost afternoon. Emma Black, Child Welfare Workforce Development Manager with the Northern Academy. I work in close partnership with CDSS to support statewide implementation and Fidelity for child and family teaming and the IPCANs. And I'm a former CFT meeting facilitator. So whoop, whoop, great to see so many facilitators in the house today. And I'll pass the mic to Shelley.
Morning, everybody. I'm going to call myself a CANS ally. I'm very supportive of CANS. You all know I love it. So CANS, CFT, now I'm going to say CPIP, consultant and trainer, and working with several counties and loving it. And I'll pass it to you, April.
Hi, everybody. I'm April Fernando. I'm a consultant to CDSS and helping them help you all get ready for the tiered rate structure that's coming in a year or so. Nice to be here.
Awesome. Thank you so much. And then also we have Sahar from our team who is helping to monitor all of the things behind the scenes. So we do appreciate Sahar being here as well. And we'll go ahead and just dive right on in. So again, if you haven't had a chance to drop your name in the chat and where you're from and your role with the IPCANs and CFT Fidelity work, if you could do that, we'd appreciate it. And we're going to go into a Menti. So here is the QR code. You can use your phone to scan that. You can also go to menti.com and enter this code. The link is in the chat. And so we'd like to get an idea about whether or not you were able to attend our last, the Fidelity webinar on the 18th. So we're just going to give you all a moment to respond to that to see, just kind of get a baseline of who's here in our space with us today, what understanding you have of what was covered, and it'll help us to know how deep we need to go in some of the pieces that we have on our agenda today. So we'll give you all just a moment for that. We have a couple of folks who can't remember if they were there. Hey, you know what? I also have been having that kind of a couple of weeks too. I feel like I've just been running. And each week I assure myself that next week will be better. So that's how I've managed to get through the year so far. But so anyway, I understand if you cannot remember. But it does look like a good portion of you have participated in that webinar that we had on the 18th. Those of you who are joining us who did not, no worries. We're going to do a recap, and we're also going to take a deeper dive into a couple of different places. So again, happy to have all of you here. So let's see here. And if you could, in the chat, if you could also maybe add, if you did attend that webinar on the 18th, what was a key takeaway? So if you could add that into the chat, we'll be kind of checking on that and see if we can cover some things, or even if you had any questions from that session on the 18th. So key takeaway or any questions that you may have. All right. And so while you're doing that, we will go ahead and talk a little bit about our group agreements here. So this is what we proposed last time, and folks did agree to them, so we didn't really make any changes to them, but I just wanted to do a quick check-in. So our group agreements for today are to assume good intentions, that we have some shared responsibility for effective service delivery to build strengths and address the needs of children, youth, and families in this work. We have respect for each person, commitment to fairness and equity as we are working through all of this. Be solution focused to, oh, and I still did not take out that typo of the 2. I need to make a note to do that, but be solution focused to overcome barriers as they come up. Use the raise hand feature during discussions and use the chat feature for comments and questions. So if I could get just a thumbs up from all of you, an emoji of some sort that we're in agreement with these group agreements, I'd appreciate it. And also, or if you have something that you'd like to add, or if we have adjustments that we need to make, if you could throw those in the chat or come off of mute and share those, then we'll make sure we add them. All right. Thanks so much. Thank you for engaging with us this late morning. All right, and so we're going to go ahead and move into our recap. So I'm going to turn it over to Robin and let her talk a little bit about some of the things that we covered in our last webinar.
All right, thanks. All right, so this is the IP CANS and CFT Fidelity All County Letter. It's All County Letter 2554, and this is some information on it. I'm just going to give you a high-level overview of what's included in the All County Letter, or the Fidelity All County Letter. It was released on August 26th of 2025, so not too long ago. Hoping folks have had a chance to pick it up, read it a little bit, explore, and things like that. But as you can see, it includes some background information on the IP CANs, CFTs, the tiered rate structure, and I guess the IP CANs, in order to try not to use too many acronyms, is the Integrated Practice Child and Adolescents Needs and Strengths. CFTs are Child and Family Teams, and again, the tiered rate structure also can be referred to as the TRS. You may hear that. And it includes additional information on kind of cultural considerations when utilizing the CANs, for the IP CANs. We also have information on our partner and tribal engagement. It highlights the collaboration that happened with our partners and includes the engagement that was embedded through the CQI and Fidelity work group and through the 11 different listening and discussion sessions that were held at the end of 2024 and the beginning of 2025. We also have information in there about juvenile probation because there's a key update about them beginning to use the IP CAN statewide with youth in foster care beginning January 1st, 2026. That was a previously adjusted from another ACL release due to the date moving via statute. And then we also have information that is the bulk of this All County Letter, including the Fidelity and CQI measures. So it outlines the tools to measure the practice at both the system and case level. It also includes different information on data reports, training, coaching, and technical assistance that's available. And then we have our support that's available. So we have different levels of support and technical assistance available. And in there's guidance on how you can access technical assistance and what types of supports are available to help ensure counties have resources to kind of implement to Fidelity. And then we have some updated training requirements in there. They're updated based on role and covers both IP CANs and CFT meeting facilitation in there. And kind of, it does include also directions on how to access trainings as well. We can go to the next slide. All right, so for the Fidelity stuff that I said was included in there, I'm going to do a little bit more of a deep dive. I'm not going to talk too much about each of these aspects because we've been talking about them quite a bit, and I want us to focus more on the county practice and improvement plan here, which is the topic of today. But as you can see here, this is how the different Fidelity elements kind of fit together in a flow and provide a picture of like IP cans and CFT practices. The CFT brochure you can see on the left is provided to the youth, family, and the team members prior to their first CFT meeting. And then the CFT action plan is then used during each CFT meeting and provided to the court. And then during select CFT meetings only, the CFT meeting observation tool will be completed. So that's not on every CFT meeting. Additional information on kind of methodology and selection will be forthcoming in a county fiscal letter. And you can anticipate that within the next couple months, I believe. Then also following the meeting, the CFT meeting survey is completed. So we need to be encouraging folks to take that. And as you can see, in addition to kind of the meeting process flow, there's also the County Practice and Improvement Plan, or CPIP. And that's one of the things we'll be diving into more today. And that's completed by each placing agency in collaboration with their teams. And also the IP Cans Fidelity Review tool, which is a tool that's intended to be completed by the California Department of Social Services. The IP Cans Fidelity Review tool is not yet available. It's still under development, and as is the methodology for case selection. So more information will be coming on that as well. Does anyone have any initial questions on any of those? Because I know I'm going quickly through it, but if there are any questions, please feel free to like put them in the chat, and I can jump in and highlight some if you would like.
There is one question: is could the CWIP or other data analysis share how they are bringing together all the data available to track county's progress of CFTMs and CANs?
Was that a how, or is it saying the CPIP is doing that?
I think it's asking if the CWIP could. CWIP.
Maybe it's the California Child Welfare Indicators Project.
Yes.
Is what I'm thinking. Okay.
Thank you, Lucia.
Sorry, and I found the thing as well. So I think that's a great question. And yes, we're actually going to be talking more about the different data sources here a little bit later in the slide that can help inform the county practice and improvement plan. We even have a document, our CPIP completion guide, that includes data sources in there as well that kind of help identify how to track the different cans and what data can be utilized to complete that CPIP as well. So I think we're actually going to touch on that more, but if I don't cover it in a little bit here, let's circle back with your specific questions. All right. Next slide. Okay, so this is, I didn't mention dates before. This is kind of the IP cans and CFT practice Fidelity tools timeline here. And this may look familiar to you. The little yellow orange box kind of moves as we go, but this is a slide that you can see back in August is when we had our IP cans and CFT Fidelity webpage and the guidance that was released, which is that all county letter with all of the attachments, right? And then in September, which is, as of yesterday, the CFT brochures and the CFT meeting survey, those requirements that were live on September 1st. So the requirement to disseminate the CFT brochures and to encourage completion of the CFT meeting survey should have begun for placing agencies and their partners this past month. We also had a couple levels of technical assistance available, and we'll talk through those, and those launched last month as well. In January the IP Can CFT technical assistance guides, those are almost available. They will be available in October, I promise. We did have those flagged in September. We have those submitted for accessibility, but they are taking a little longer because of how robust they are. So we actually have a lot of exciting materials coming your way, and we will dive into those further at our next webinar as well. But today we're here to talk about what's happening in January, the CPIP, right? The County Practice and Improvement Plan. That's due annually of January 1st, as you can see on this slide here. We also acknowledge that there's different implementation across teams, right? Every county is in different stages of implementation with both CFTs and IP cans, or varying stages. Not let alone their placing agencies. So CFTs have been required of both child welfare and juvenile probation since 2018, I believe. But it might be 2019. I think it's 2018. But the IP cans, as you saw in an earlier slide, was not required for juvenile probation and actually isn't required of them until January 1st. However, cans has been utilized within the child welfare system for some time. So the child welfare and juvenile probation may submit the CPIP either separately or jointly, depending on where each placing agency is at with their practices. We'll talk a little bit later about how the CPIP is structured, but it's structured in a way that even if placing agencies are at different stages of implementation, there are still sections that can still be completed together. And we have more direction on that to come, but just kind of highlighting that it is a team effort, but then submitting it separately or jointly will really depend on where your placing agency is at with its implementation. Also with that CPIP team membership, it may include it must include consultation with your ILTs, your interagency leadership teams. And that includes a lot of the members here, like behavioral health, child welfare, education, regional centers. These people are on your ILTs, but not all ILTs have tribal partners involved and those with lived experience and things like that. So it's important to also make sure that you include those folks and those contracted providers who are involved in completing the IP cans or CFTs on behalf of placing agencies.
Real quick, Robin, I was just going to add that I was chatting with the county and they were like, oh, we don't have any tribes in our county. And I said, oh, do you do any tribal placements? And they said, yes. So also consider those, if you have youth placed in tribes, that those could be partners as well.
Yes, great. Thank you, Shelley. That's a great call out. Appreciate that. Okay. So the CPIP completion, there is help available. Since it is that team effort, we really did structure it in a way to kind of mimic the child and family team and the integrated practice child and adolescents needs and strengths, right? The CFT, the team, is kind of like the interagency leadership team, and the additional partners that we mentioned. And then the CPIP uses a rating scale similar to that of the CAN's strengths rating scale. And again, we'll go into that a little bit deeper. So it's important to have that CPIP facilitator or technical assistance provider who can help facilitate those conversations with the team. So we do have a training that is developed, and we just piloted it, and has already received some good some great feedback. We'll talk a bit more about that as well, but just letting you know that there is help in completing the CPIP. And the facilitator or technical assistance provider role is kind of laid out here a little bit. What they can do is help prepare and follow up with the county CPIP leads. They can also assist in identifying that team membership. So when we looked at that screen before, looking at who's on the team, and who may need to be added to the team, and helping navigate some of those conversations too, right? Getting some of the why built in there for your system partners. They can also assist in determining like meeting times, locations, what materials should be brought to the meeting, including data and stuff as well. And then they can also assist in documenting agreements, next steps, even disagreements, timelines, all of that. And their biggest role is really encouraging that safe, consensus-based participation, right? We want it to be a well-rounded tool, not just the voice of one. And they can also help connect your CPIP to other improvement efforts, such as the county self-assessment or the system improvement plan. And again, as I said, that the TA providers and CPIP facilitators are there to help as well. Placing agencies can submit requests for this help through our Fidelity Technical Assistance request form that's online. There's a CPIP completion assistance. And again, we'll be diving in a bit more to that again a little later, but just wanted to highlight it here. That's where you can request that assistance. And we encourage placing agencies to request it early so we can get a jump start on things, because we'll move quick in the blink of an eye. Okay, so throughout the last webinar, we identified some key themes that came in through kind of the Q&A, the questions and answers. Some of those included using the IP cans across system partners with the different variations of the IP cans and the cans 50. Then the county practice and improvement plan overview and demonstration. We're going to dive into what the CPIP actually looks like and what the rating scale is and things like that, and provide some information. And then we're actually going to be diving in more to the CPIP completion guide as well and highlighting some of the tools that are in there, or resources rather, they're not necessarily tools. And then again, like I said, we're going to be diving into some of those data sources and taking a look at what's available. And looking at some of the technical assistance as well. And throughout these, as we talk about our key themes, this is where we additionally welcome your questions. And we want to have a conversation with you with whatever may be lingering on your mind for these. But we will have it somewhat timed. So if we don't get to them all, just put them in the chat. And we are circling back with Q&A documents after the learning labs as well. I think we're ready to dive into our first one. Okay, so using the IP cans across system partners. So really this is, we're hearing a lot about how there's the IP cans, the integrated practice cans, and also the cans 50, right? Because the child welfare and juvenile probation starting January 1st are required to use the IP cans with their youth. And behavioral health has another requirement of the cans 50. So a lot of the times when counties are partnering together, it's either one is completed or the other is completed, and there's difficulties on knowing which one is completed or which one needs to be completed and things like that. So what we're trying to do is add a little bit of clarity and just some of those key differences of the tools. Completing the IP cans does actually satisfy the behavioral health requirement because it includes the cans 50. The IP cans, what's the difference between the two? The IP cans, or integrated practice cans, again, includes the cans 50, so those core items, but also includes 12 trauma items. Those 12 trauma items typically stay relatively static unless a youth experiences additional trauma. And the IP cans allows the completer to complete the IP cans on behalf of up to 4 caregivers. So that could be both parents, it can be, 2 resource parents in there as well. But again, it's up to you. It's not that you have to, if there's not 4 caregivers, you wouldn't try to squeeze more in. And then the cans 50 does not allow up to that many caregivers. So we have additional caregiver focus. We have our trauma domains in the IP cans. And then also the IP cans has an early childhood module for those children under the age of 5. So it's important to highlight kind of those differences. And in ACL 2554, which, as you remember, is the Fidelity ACL, we do clarify that formal agreements between systems should explicitly say that it would be the use of the IP cans. While the IP cans does satisfy the behavioral health requirement, the cans 50 does not satisfy the child welfare or the juvenile probation starting January requirement the other way around. So it's important to kind of note that there. And I guess I can open it up to questions and what this looks like, if people have any questions here. And I guess this is where we would kind of stop the recording.
We've been we've been sitting with this tool for some time, and we still have to take a breath because it's quite a bit to sort of understand. As you begin to plan how your county is going to go about completing this tool, I hope you consider having someone to help lead that process for you. If you have someone on your staff that is your champion around CFTs or CANs, or you have an official CANs coordinator or someone like that, that might be the person who could do this. If not, we do have support available to you through CDSS and the Cal Academies who can help with this process. Because we know that it will take some organization and facilitation skill to lead a team to complete this tool, we created a guide that could be helpful for that facilitator in leading the process. And not only that, we have a training that they could take that they could, we can help them practice those skills. We had one of those trainings, our pilot training this Monday. We have another one coming up on October 17. We'll probably, and that information will be shared soon in the chat, I'm sure. And hopefully we'll have more to share with you. What I'm going to show you is the CPIP completion guide, which is available. But I wanted to give you the context of why we even created this and who the guide is for. Okay, so let me share my screen. I promise I won't make you sick this time.
April, we're seeing a Zoom window.
Oops, sorry. I wasn't able to. There, is that better?
Yep.
All right. So let me get this. So this is the completion guide. And it has, it outlines 3 sessions that you can use to complete your CPIP, right? It has the introduction and administrative overview. It's kind of that very first initial part of creating that team environment, making sure the team feels safe, outlining what their job is, making sure everyone understands what the CPIP is and the purpose, making sure we have the right people in the room. And then we encourage people after that first session to what we call pencil score. If you're used to the CANs, we talk about this all the time, to score the CPIP on your own so that when you come into the next session, you're prepared, you've thought about some things, and you have some thoughts to share. Now, the administration session may not take 1 session. It may take 2, 3, 4, 5. It depends on how big your county is, how big the team is that's completing this tool. So it really does depend. And this is something you have to plan with the facilitator on how many sessions you need to set aside for the administration. The third part of this, or the third session, is really to review the tool and then to prioritize those areas that are rated 2 or 3, and maybe combining some of those areas together so that you can start to create your improvement plan. If you notice in the CPIP, and I didn't really go down to that page, but in the CPIP, there are only 4, I think, plan boxes. That was on purpose because we don't want 10 parts to your plan. We just want you to focus on the places where you can get the most impact from the strategies that you're going to be working on. So as you look at this guide, you can see that it has learning objectives. It has different things that we, preparing materials, overview on how to do introductions. It's very detailed because it's a guide for facilitators. Okay, and it's, it's got a lot of words in it. And we try to give you as much support as possible. Let me get out of this for just a second because I want to show you the appendices without making you completely ill. There are, so this is a suggested, way to document your meetings. And there's going to be a fillable form coming soon. But you don't have to use it. You can use your own. But we want to make sure that you do document your meetings because it will help you in reviewing the CPIP and preparing your plan. One of the appendices here is called Questions to Consider and Data Sources. So if you're familiar with the CANs, you know that each of the items has some questions to consider to help you understand how to talk to youth and families about a particular indicator, a particular area. We have similar questions to consider that you can use as a facilitator to help kind of warm up the team to make sure that they are understanding what the purpose is of the section and how to go about answering those different statements. So for each area, you can see that we have these blue boxes for questions to consider. And you can see that we aligned some of the data sources for each of the topic statements with some suggestions. And I'm going to scroll down to show you something more specific if I can get there. Oops, I passed it by. All right, so this is a different section. This is the IP CANs practice section. Lots of questions to consider for this section. And then again, the data sources you can see here. I wanted to show you this. So you can see here that it identifies survey data, and on the CFT meeting survey, there's particular numbers. These are question numbers from those tools that actually link back to this particular statement. So we try to do the hard work of lining up the data sources, the information, so that you didn't have to look too hard for it.
I just want to jump in here to say that this is part of why a lot of what's in the beginning part of this document is making sure that you have the right people in the room. And there might be different people who are differently informed and situated to fill out, for example, the ILT section that talks about your interagency leadership team and their functioning versus the folks who might be most informed to give information about the CFT or CANs practice section. So really establishing that in your first CPIP meeting when you're starting to talk about what's in this entire thing and how you will get that information to collaboratively, with an emphasis on consensus, complete this process is really important. And if you get to a section and you're hearing crickets and the responses that people are saying, I don't know, pause and say, who can you talk to get that information? Or who can we invite to our next meeting to make sure that we are informing this part of the tool accurately? Hopefully you've also got those data reports available, but we know that data available is only as good as data entered. So if there's a gap between practice and data entry, again, you may need to pause and find out who the key informants are that can help you to accurately fill in that portion of this document.
Yep. So let me pause before I go to the next appendix in this document, because it's going to shift our focus to see if there's any questions that you all might have about the completion guide, the CPIP completion guide.
For those of you who are here who are in a TA, technical assistant support role, can you just raise your hands or give us a thumbs up real quickly? Because I know we've got at least a few of you. Awesome. Happy to have you here. Please let us know how this guide is working as you start to use it. I am preparing for my first CPIP meeting facilitated conversation tomorrow, and I'm finding it to be very helpful. There is a whole lot of information in there. And I imagine as I start to actually move through this process, there might be things that I'm penciling onto the guide to say like, oh, here's a question that came up, or here's an area where we kind of got stuck. So we also want to hear your feedback as you're using this as a resource, because we're all trying it on together in real time.
Yeah. And happily we'll make updates to it to make it easier for others to use as well. All right, there's another appendix in this document that might be helpful. So there was a IPCAN CFT coaching and technical assistance framework work group. If that's not a long enough name, I don't know what it is, that was working very, very diligently to create technical assistance activities and supports to be used after the CPIP has been completed and the plan has been developed. These TA guides might be helpful as a strategy to use to improve practice in the county. So what this appendix does, it identifies all the CPIP topic areas and the statements. You can see them here. And then it has these blue boxes where it says, here's the associated coaching and TA guide, right? And it points to which ones they are. There are 22 TA guides that will be available soon, as Robin mentioned earlier. And they have materials accompanying them. Sometimes they have slide decks. Sometimes they have information sheets. The data section has 100 pages of data walkthrough. So if you don't know how to use this, which Robin's going to show you, the CCR dashboard, there's a whole guide that walks you through how to use the CCR dashboard. Okay, so that's what this is, so that you don't have to scramble to find, I wonder if there's a guide for that. This one will tell you, look, there's a guide for this. There's a guide for this, right? So that's what this particular section is about. All right, any questions, comments? Stop sharing. All right, I'll turn it back to you, Joanne.
All right, thank you. I'm actually going to not share screen just because we are going to be talking about data sources. Although, hold on, I lied a second. We are gonna share screen because
Joanne, you can just throw it to me. I think I can show up that PowerPoint slide, but because we're behind, I'll just quickly go. Sorry, I was typing that to you, but didn't get it.
Oh, okay, perfect. Thank you.
Thank you. Sorry, I'll share screen as well. Although you might. Me too. You might just see yourselves for a moment. Oh, my dog. That's Buddy. Then PowerPoint slide. There we go. Okay, our CPIP data sources. So the CPIP is grounded in multiple data sources, and they're kind of organized here into those three different themes that April was going over. So you see we have our system of care, our practice, and our data. And I'm going to go through this really quickly because we don't have a ton of time left. But just to mention, the CPIP isn't just based on the one data set. It draws from these multiple sources to ensure that our planning is grounded in the evidence, practice, and system level insight. We look at this system level, what happens in practice, what's happening with families, and what the data is showing throughout this. So it kind of provides that balanced approach. So you can see some of the data sources here may not actually be available yet. The IPCANs and CFT Fidelity tools, some of them are still to be launched. So if the data source is not available, there are CFT meeting notes or other interviews that can be used instead. but you'll see like the CFT meeting observation tool. If you remember, that doesn't actually, the requirement doesn't begin until April of next year, which is after the initial CPIP completion. Some counties, however, have used the CFT meeting observation tool in the past and have continued to use it because it is a tool that has been recommended and around for a number of years. So if a county does have that available, then obviously bring it into the CPIP information and use it as a data source, but also don't be surprised if information is not available because some of these things are still up and going. If you look, the system of care sources kind of reflect how services are structured and governed, like the policies and procedures, AB 2083, MOU, meeting notes. The practice source looks at kind of like that day-to-day action plans and Fidelity reviews, and then the data reports are actually like looking at the numbers and providing the numbers. And just highlighting again, just like Emma said, the data is only as good as what's entered, right? So as we look at potentially what is available through the CCR dashboard, which you can find on our website here. I've already opened up these links so we didn't have to wait for them to load, but I just wanted to highlight here. This is one of the data sources that is available through this source, and I just wanted to show you here. There's a user guide, methodology, and then new dashboard, which I do have these sources up, but unfortunately do not have time to go through them all, but you can see these are available. The CCR dashboard, just to kind of show you, it includes a lot of information. There's STRTP here, placements and exits, resource family approval. But if you keep scrolling, we have new functionality, which is very exciting. We have our child and family team meetings and our integrated practice child and adolescents needs and strengths on here. In order to go into these, you just click here, the IP cans, click here for CFT meetings. And again, due to the time, I can't do a full deep dive, but I will click to kind of show. And we do have another webinar. Our 5th webinar does touch on data sources again, so we might be able to dive deeper too, because I know we did have some questions. But if you look up here, you can, there are a number of different reports here. This is where we can find our first IP cans within 60 to 120 days. If there's no IP cans completed, or the number of days to the first IP cans, which you can see has gone down. So this first one, of the children and youth who have been in care 60 to 180 days, what percentage received their first IP cans assessment within 60 days of entering foster care? This one is specifically kind of called out within ACL 2554 as one of those markers or indicators that CDSS will begin looking at July 2026. So I just kind of wanted to highlight that there is the same report for the CCR or the CFT dashboard as well. If we, maybe it won't let me click right now. Not sure what's happening there. So, but just rest assured, it has a very similar look. It actually has a few additional reports available there to highlight that. We also have our decision support model requests that you can find on our CANS webpage. So this is just the Integrated Practice Child and Adolescents Needs and Strengths CANS webpage. If you scroll down to the bottom, there's a decision support model county distribution request process. And it has all the information in there with the link to request that information. As we said in the chat, we are trying to develop a streamlined process of how counties will receive all of this data and all of this information, but that is still to come. We're trying to see if we can develop something that would be able to be accessed on their own as needed. But until then, please email us. I know we put our email in the chat a number of times, but we can do so again. I'm going to move us forward again really quickly without going back to the chat. And just, we can put this flyer in the chat. It's also linked on the Fidelity webpage, but this is kind of a Fidelity through TA. It goes over some of the technical assistance and CPIP connections there that are available. And it's kind of more at a glance. So this includes a lot of the information that we talked about today, but kind of in more shorthand of what's available and how to request technical assistance as well. And then this is the technical assistance request form. You can see it's not a difficult form, name, email, phone number. There's some check boxes, areas of TA requested. As you can see, that CPIP completion assistance is there, but we also have meeting observation and, CFT, IPCANS practices, data, system of care, training needs assessment, and other. And then we just ask you provide a bit more information. And then we ask about time frame. So it's pretty simple form to fill out. And we welcome you all to submit requests if needed. I know we entered it in the chat. I don't know if we have any questions. I know we have 5 minutes left. Are there any questions on kind of the data pieces that I went through, or the other technical assistance? I know I kind of lumped those two together, and I apologize for that. I just wanted to make sure I gave you the information and we could have your questions now. You see that one from Sharon? Hang on. I got it. You guys, I see a question in the chat. Thank you for pointing it out, team, about asking if this is available in safe measures. We do not have the same information that is on the CCR dashboard on the safe measures reports yet. We are in the process of building those so that we can mirror those, and then safe measures could potentially provide more of a drill down ability to kind of explore a little bit more. Again, they're not there yet, but we are exploring that right now. So hopefully to come. But there are other useful timeliness reports. They just look at the data in a different way, time frame wise. So it doesn't quite align.
I think things are being answered in the chat as they're coming in, or you're capturing them, Robin. So we'll just continue to move ahead here. I know we only have a few more minutes. So we did want to share some information about the CPIP facilitator training. So there is another opportunity that is coming up on October 17th from 8:30 to 12:30. So if you did not have a chance to join us on September 29th, which was that yes? No. Yes, that was 2 days ago, Monday. We do encourage you to participate on the 17th if you are planning to provide technical assistance or to be facilitating the CPIP discussion within the interagency leadership teams or within your county. So please note this and register to attend if you have not already. We also do have, let's see here, sorry, the next learning community for CPIP there's a learning community that's also being established for CPIP facilitators and TA providers. So this is an opportunity to have questions answered, to have conversations with others who are doing the work, learn from one another, and to be able to really hone those technical assistance skills as you're working with counties. So for those of you who are on this call that would be doing that work, again, we encourage you to participate in both the CPIP facilitator training as well as this learning community for CPIP facilitators and TA providers. And so the first one is going to be October 13th from 12 to 1:30. And again, this is designed for anyone who's anticipating being a facilitator for these conversations and helping your county to complete the CPIP. All right, there is a link for the set training on 10/17. I think it's been dropped into the chat a couple of times, but maybe Emma, if you wouldn't mind dropping it in one more time. And then, oops, we went a little too far there. So this is where we're at with the upcoming Fidelity webinars and learning labs. As you can see, the ones that have already taken place and the ones that are upcoming. So the next one that you should have on your calendars is the development of the CPIP strategies. So, and the improvement plan and use of the TA activity guides, which is going to be coming up next Thursday, October 9th from 9 to 11. And then the learning lab that is associated with that webinar is going to be on Wednesday, October 15th from 11:30 to 1. And as you can see, we still have 2 more additionally that will be scheduled for those webinars. the CFT meeting observation tool and CFT meeting summary and action plan, as well as supporting Fidelity available resources and data sources, which we'll be covering in December. So if you have not registered for these, please do so. We look forward to seeing all of you. And with just 1 minute left to go, I want to go ahead and do a check-in to see what worked well about today. What would you suggest as an upgrade for future learning labs? You can type that into the chat. If it looks like we are recording, I can't quite tell. You're welcome to come off. Oh, sorry about that. Go ahead, April.
All right. So I'm going to share the CPIP. Before I do, I just want to say something that in case it takes a lot of different ways to say something to understand something, if you're like me. So the way that I understand this tool, it is a collaboratively completed tool, but what it does at the end is it provides a gap analysis, right? To help you understand what's working well and where are those areas that you need some support around. So I just wanted to share that. And now I'm going to share the CPIP with you. And hopefully you can see my screen. Yes. Oh, thank you, Joanne. All right. So this is the PDF version of this tool. Ultimately, this tool will be submitted online. There's going to be an electronic version of this tool online that you will use to submit. So I would encourage you to use the PDF version as you are meeting in your CPIP completion team or whatever you want to call it, so that you can share and look and really mark it up, and then someone can enter it into the online portal. All right. Just some information on who's completing the tool, who participated in the process, and what information you might have used to complete the tool. The sources of information are not required. It's just we want to know if the information that we noted here is helpful. You can see their dates on here because not all of the information is available right now. So we wanted you to note when things might be available. And you can also list in other sources that you might be using because your county might be tracking things all on their own, which would be awesome. All right, so there are 3 topic areas for the CPIP. And the first one is the system of care area. And this helps us understand whether or not there is infrastructure and leadership behind the implementation of the IPCANs and the CFT practices. And I'm going to go into the rating scale after we go through this. So if you have questions about that, just hold them for a second. But you can see here that we have an area. It's called the Interagency Leadership Team, the ILT. And this area has several statements that you're going to want to review, discuss, and then rate using this rating scale as part of the team. Okay, so I'm going to go through this. If you have particular questions about anything in these topic areas, please put them in the chat, or someone can raise your hand and someone will alert me that you've got a question. The second area in system of care is how is the CANs being utilized and how are the CFTs being utilized across the county? And these 2 questions I know most people have seen. 90% of the children, youth, and minor dependents have a CFT, and 90% have a CANS. That's 2 of the things you're going to be rating. There's also a section here to help your team understand how are the partnerships going between the different system partners in your county. And so that's what this is all about. Okay. The third section is looking at your policies and procedures related, your local policies and procedures related to IPCANs and CFT. So the state will provide guidance, but that guidance might need to be drilled down a little bit further into how it's applied locally. And that's what we're wanting to understand here. So there's a section on CFT meeting facilities and process. There's things around the CANs, timeliness of documentation, training and completer requirements, and confidentiality and sharing information. The next section is really about, are the documents in place so that information can be shared around the CFT and the CANs? And then the last two sections in this particular area have to do with resources. Are there fiscal resources and contracting to sustain the CFT and IP-CANs practice? And are there appropriate staffing resources? I know you guys are laughing right now. Staffing resources and technology available for an effective IP-CANs and CFT implementation. All right. Any questions about the system of care area? Are there any in there, Emma? No? Okay. The next area is the practice area, and it is the largest area. So it's going to cover CFT, IP-CANs, and a short section on ICPM informed IP-CANs and CFT practice. So we're going to want to know something about how the CFT process and preparation methods are in the county. And that's what that first section is. Meeting logistics. These, by the way, as you've heard us say over and over again, come from so many surveys, listening sessions that folks with lived experience and also professionals who are providing this work have told us these are the things that are missing. Okay, meeting practices. And then down at the bottom, we have IP-CANs practice. And then the ICPM section is down below there. If I'm going too fast, let me know. If you have specific questions, happy to answer them if we can. All right, I'll keep plowing through. The data section is really about how IP-CANs and CFT data and information is being used at the system level, at the county level, to make decisions to understand what is happening with children and families in the county. So it's not the case level that you're used to using CFT and IP-CANs information, it's the system level. So the first section is around, are there documentation and monitoring things in place? And you can see here we're starting to refer to specific reports and data sources that would be helpful for you to use in understanding and answering these particular statements. The next section is monitoring IP-CANs and CFT fidelity. Are you using the fidelity tools, basically, is the question. In the case of the IP-CANs fidelity review tool, which is completed by CDSS, are you using the feedback from those tools, from that tool? The third section is, are you monitoring outcomes? And someone asked if the Child Welfare Indicators Project would be helpful. It's helpful here, right? These are specific reports on CCWIP. And finally, is the IP-CANs and CFT data being reviewed? And is it being used, again, for decision making? And in that review, is the data being shared out to staff as well as, you know, the constituents, the people receiving care, because that's important too. So that's the CPIP in a very, very quick review. Are there any questions? All right, I'm going to talk about the rating scale. Hopefully that didn't make you sick. Sorry about that.
Sorry,
April.
I have a question. I was trying to find my raise hand feature.
Sure.
Question for you. So in reference to going back on, let me see if I can find it here. On 3.1A, it says the CFT meeting occurrence is tracked using safe measure reports on an individual and aggregate level. To my understanding, safe measures, the state has clarified that safe measures is not a requirement for county placing agencies. It's recommended. So how does that work for the rating if it's not a requirement?
I'm gonna bump that over to Robin and company.
For rating, I would say it's not applicable.
Sorry, I just unmuted.
Oh, I'm sorry. Hi, everyone. Rebecca Buckmiller here at CSS. Stephanie, I think for that rating, no, understanding that our probation partners, for the most part, do not have access to safe measures, and it's something that's might be a future add, but in the interim, I would say mark that as not applicable if they don't have safe measures.
Or a 3.
Or a 3. Yeah, that's true. We aren't requiring it, so it's if marking it as a 3, we want to make sure that we're not saying that as marking it as a 3, that means you must work towards getting it.
Sure.
But okay, all right.
Right.
And is there
Remember, for strikes,
any-
you don't have to work on things if they're not appropriate.
That's right.
okay, and so is there any way, so first of all, I guess I want to provide clarification. Some probation departments do have safe measures, but there are some counties that don't. And so, or some county probation departments that don't. So I was thinking more of those particular departments. So would there be some clarification shared, in future guidance letters, or is there something that can be sent to CPOC so we can make sure we share that clarification?
Yes, and I think we should also probably include that in our facilitator training too, for folks that are guiding the counties as well, and our TA providers. Yeah.
Thank you.
Great question. Thank you, Stephanie. Other questions?
I just have a question related to that item as well,
Sure.
because are you hoping that the administrators will monitor safe measures usage in the safe measures tool to determine this?
Not really. We just want to make sure, I'll let CDSS answer that question. One of the things that we want to make sure is that that there is data that's being reviewed.
And how do you want counties to measure that, like through survey or?
I think it likely depends on the county, but I think it would be an internal question to leadership. Are they taking a look at what safe measures is showing? Do they log in and take a look? Is it being used by supervisors, things like that? And it would be really up to the county on how they determine that specifically, if it's safe
Right.
measers, which
And
is probably depends on the size and stuff as well.
And I would say that if you're not using safe measures, then what is being used? How is Fidelity being monitored?
Right. Because there's
Thank you.
H down at the bottom here too, right? There's an other, and you can say what it is you're doing if you're not using safe measures. So remember, this tool is really about understanding how you are using information. And if it's not safe measures, if you have other information you're using, we want to hear about that. Any other questions? All right. Sorry to make you sick. There you go. So the CPIP has a rating scale that is, sorry, that is a strengths rating scale. And what this means is that each of the statements that I showed you on the CPIP could be thought of as a strength of the placing agency that's useful and accessible to them in their IP CANS and CFT practice, right? And this was purposeful. When the CPIP was still being developed, it was a mixture of different kinds of things that you would, different types of questions, let's put it that way. Some were open-ended, some were, you know, on a ranking scale. But when it came down to it, it was important to frame this as strength development, like the county's ability to develop understand their strengths and develop strengths where they need to. So that is why the strengths rating scale from the CANS has been slightly adapted to be used in this case. Okay, so when we think about the rating scale, we want to understand if the statement is identifying something that's currently a strength, right? So if you look at this flow chart at the bottom of this slide, the first question is there evidence of a strength in this area? Okay, if the answer is no, then you're going to rate it a 3 for no evidence of a strength. And if it's not something that is like what we just talked about with safe measures, it might be not something you're not going to need to develop anytime soon. Then you're not going to put that as part of your plan to work on it. And you're going to make a note in that section of the CPIP saying why you're not going to work on this 3. Okay. So let me go through a really quick example. So in section 2.3J, there's a statement that says, if you want to look at it, the IP CANS completers have an active certification which must be maintained. A process is in place to monitor ongoing compliance. So if the IP CANS completers in the county, let's take child welfare as an example in the county. If the IP CANS completers for child welfare as the placing agency are not actively certified, and there's no process in place to monitor their certification status, that statement should be rated a 3. 4, not in place, no evidence of a strength. Okay, so however, let's take another scenario. If the IP CANS completers are mostly actively certified and the process to monitor certification is in place, but it's not always being used by supervisors or whoever to help monitor certification of the IP CANS completers, how would we rate that? Okay, if you said a 1, then you're right. So this is how we're going to use the rating scale to help us understand if this is a strength, and is this a strength that can be accessed consistently or not? Or is this a strength that needs to be developed? Okay, at our next learning lab, we're going to go into more practice on this, but we wanted to introduce it since we hadn't talked about it at all. Any questions about the rating scale?
I just wanted to really emphasize that it is okay, it is normal, it is expected that many counties and placing agencies will have a lot of 3s and 2s on their first CPIP. This is a baseline assessment. This is an assessment of how your system of care, your local practice is functioning currently. And then part of what we hope to do with this is to help you to develop a plan. What are the key areas that you need to target to improve in? and to be able to guide and support through the use of technical assistance activity guides or additional support, so that hopefully when you fill out your next CPIP in 2027, we see improvement in those areas. We see that placing agencies are going from a 3 to a 1, hopefully, right? You're building a strength. You're going from something where there was perhaps nothing occurring or a need for a plan to seeing that that plan being in place has led to progression and improvement in that area. So if you're hearing some of these examples and having a little bit of internal panic, we just want to be sure that you know that no one's going to be judged for having a lot of 2s and 3s.
And we're going to talk about this more at our next webinar and our next learning lab. So I'll refrain from saying any more about that.
Any other questions about the CPIP process, timeline, how to go about completing it, etc.?